for coming. Thank you.
Whenever you're ready, Senator.
Okay, thank you very much, Madam Chair. I'm here to present SB40, the Insulin Affordability Act. And I want to start by thanking the committee for working with us, and we're happy to accept the amendments in the committee analysis, removing rapid-acting inhaled from the definition of drug type and only including one definition of drug type in the bill. So SB40 caps the monthly copay for insulin at $35 for a 30-day supply and prohibits step therapy requirements for insulin treatments unless health plans have at least one insulin for each drug type covered, similar to what's in statute for antiretroviral drugs for HIV treatment. We know that there are hundreds of thousands of Californians diagnosed with type 1 diabetes each year, and 4 million adults in California have diabetes overall. Insulin is not optional, it's life-saving, and people should never have to choose whether to get their insulin or buy food or pay rent, and they should never have to ration insulin, which unfortunately we know is happening. The Inflation Reduction Act, which has not been completely repealed, only partially, caps insulin copays at $35 a month for Medicare, and we should do the same in California for the health plans that we oversee. The time has come. This bill has been receiving essentially unanimous bipartisan support, and I respectfully ask for an aye vote. With me today to testify is Shagun Bindlish, Dr. Shagun Bindlish, a diabetologist and internist, and Benton Buecker, president of the Democratic Club at UC Davis.
Thank you. You'll each have 2 minutes.
Good afternoon, Madam Chair and members, and thank you very much for the opportunity to speak here today. My name is Dr. Shagun Bindlish. I'm a board-certified diabetologist, obesity medicine and specialist, and scientific and medical director of American Diabetes Association, Northern California Leadership Board. I'm here today to express my strong support for the bill SB40, especially the provisions that make insulin more affordable and accessible for every person who needs it. Insulin is not a luxury, it's a life-saving medication. For people living with diabetes, especially with type 1 diabetes, it is essential for daily survival. Yet, I see too many patients facing barriers that compromise their health and safety that result in diabetes fatigue, impacting their mental health and frequent hospitalizations. One of my patients, a 28-year-old who had type 1 diabetes, recently shared that he sometimes has to choose between his paying rent and buying insulin. These are choices no one should have to make in a state as resource-rich as California. There are many other patients who try to even stretch doses to get enough through the month. SB40 is a meaningful step forward. By capping insulin cost and improving access, this bill ensures patients can focus on their health without the fear of financial hardship. This bill is not just about numbers on a spreadsheet. It's about human dignity, equity, and it is also about saving lives and preventing avoidable suffering, especially like complications that patients who are facing uncontrolled diabetes face every day, especially like limb amputation is one of the major causes. As a physician, a scientist, and a passionate advocate for my patients, I really urge to support SB40. Thank you very much for your time.
Thank you. Please go ahead. You'll have 2 minutes.
Good afternoon, Madam Chair and members of the committee. My name is Benton Buecker, and I'm a student at UC Davis here representing the Davis College Democrats, and I am proud to support SB40 to cap insulin copays at $35 a month. As a college student, I know how hard it is to make ends meet. A recent poll of U.S. college students found 1 in 5 students have less than $100 in the bank right now. Moreover, 47% either don't have a savings account or have one with no money in it. Overall, 23% of undergraduates are experiencing food insecurity. These statistics make life difficult for college students, but for students with diabetes, these statistics can be deadly because California, unlike 28 other states, has yet to pass insulin copay cap protections into law. Insulin is not optional. In California, a health plan can charge $250 for an insulin copay, and that's after you've met your deductible. If you haven't met your deductible, they charge the full price, which can be $1,000, even though the health plan or their PBM never paid that much for the insulin, as a result of rebate contracts with manufacturers. In fact, the Federal Trade Commission found in their investigation that patients with deductibles and coinsurance were forced to pay more out of pocket for their insulin than the entire net cost of the drug to the payer. SB40 is a necessary step to making insulin more affordable for Californians, including college students and others who live on the margins. Now, with rising prices on basic necessities like food and housing, insulin copay protections are needed more than ever. Insulin is not optional. I therefore ask for your aye vote to cap insulin copays at $35 a month. Thank you.
Thank you. Are there others in the hearing room who would like to offer a Me Too? Please come forward.
Good afternoon, Madam Chair, members. Mari Lopez with the California Nurses Association in support.
Jennifer Carroll from Sacramento. I support SB40.
Noelle Timonen from Livermore, California. I support SB40.
Christine Christensen from Danville, California, mother of a type 1 diabetic. We are both in support of SB40.
Valerie Kavakovich from Alamo. I am in support of SB40.
Rhea Bintlish, president of Dublin High's chapter of American Diabetes Association, in support.
David Gonzalez, a student at California State University, Chico, and I support SB40.
Alice Nito, as a student of UCLA, I'm in strong support of SB40.
Benny Mock, UC Davis student, in strong support of SB40. Thank you.
Matt Diamond, I'm a CPA in San Francisco, in full support.
Christine Falabelle on behalf of the American Diabetes Association, and as someone who has lived with type 1 diabetes for 25 years, in strong support.
Mark Pasos from Pleasanton, California, living with type 1 diabetes and insulin dependent for 50 years, in strong support of Senate Bill 40.
Michaela Spencer on behalf of the American College of OBGYNs District 9 and the California Podiatric Medical Association, in support.
Matt Leger with SEIU California, in support.
Michelle Rivas, California Pharmacists Association, in support.
Alex Kahn, California Chronic Care Coalition, in support.
Diana Douglas with Health Access California, in support.
Tim Cole with California Academy of Family Physicians, in support.
Madam Chair and members, Rand Martin on behalf of the AIDS Healthcare Foundation, in support. Thank you.
Kevin Guzman with the California Medical Association, in support.
Thank you. Are there any others in opposition to this bill who are primary witnesses? Seeing no opposition primary witnesses, are there any others in the hearing room who want to offer a Me Too? Seeing none, I will bring it back to the committee for questions or comments. Assemblymember Patterson.
I was back just in time to comment on another bill. Well, I appreciate you bringing this bill today. I don't really understand why insulin is so expensive. I don't necessarily think, I think there are a lot of parties that contribute to that, not necessarily only, the health plans or whatnot. I also don't think California is capable of producing its own. I think it can be produced by the private market at this price, but it doesn't make any sense why insulin, which has been around, the first peptide created, is so expensive. And so, I think we obviously got to do something about that. I think this is something to consider. This bill's maybe a step in the right direction. And if you can enlighten me on why you think it's important or why it's expensive, I'd be happy to hear that. But just my comments are more in tune to this is people die without insulin. This isn't some, drug that people can optionally take. I grew up, one of my best friends was type 1, and at that time in the 80s, he was scared of dying, from eating the wrong thing, and they didn't have continuous glucose monitors back then. So, but anyways, after, 40 years, insulin's more expensive, not cheaper. So I don't really understand that. But anyways, thanks for bringing the bill.
Thank you.
Assemblymember Addis.
Sure. No, thank you, Senator, for bringing this. I supported a bill like this, similar bill last year that I know that struggled, and I'm glad you brought it back this year. I think it's incredibly important and appreciate you working on it, and happy to move the bill and support it when we have quorum.
Thank you, Senator. This it ensures that we are able to instill an insulin copayment cap, which I think is so critical, particularly in this moment in time as we are trying to ensure that we are focusing on a healthy California and affordability at the same time. And I think certainly when it is available, we'll have higher levels of adherence and insurance that people won't be able to suffer as much. So with that, would you like to close?
Thank you, Madam Chair and colleagues. Yes, we, to Mr. Patterson, we have a broken healthcare system, and there are a lot of the costs are distorted, and there are many things we need to do. And I appreciate a lot of leadership on this committee around some of these issues. I also just want to say that my father is type 1 diabetic. He actually developed it as an adult in his 30s, which is not common. I still remember when I was a child and he first had it, and it was very, very hard. And insulin has kept him alive, and he's been very privileged that he's never had to struggle with the cost, but it really made me understand in a very personal way what it would mean if someone were struggling with the cost, that you have to take it. It's not optional. It's not like you're just going to feel worse if you don't take it. You're going to not be with us any longer. This is not optional. It's time to cap the copay, and I respectfully ask for an aye vote.
Thank you. And when we are able to establish quorum, I'm sure that will come. We'll move on now, and thank you for the Davis Dems for coming to speak today. We'll move on now to your second item, SB 363, which is about healthcare coverage and independent medical reviews.